Hello everyone, good evening. I've logged in a little early, 5 minutes earlier than the scheduled time, because I needed to check whether I'm able to connect with Dr. Sandesh.
Hi. So
Hi,
I
good
have
to see you.
I have joined from another account. The artist Sachin Kharat, it's on his account. So we'll be happy to join on this phone. All of us are here. So
Yeah,
thank you so much.
I was actually trying to get Sachin also online, but I was somehow not able to get him. I don't know. There's something. Is it something to do with the permissions there or something?
Yeah, can start. Okay.
Probably. All right. So, congratulations. First and foremost, I would like to congratulate you for this beautiful facility that you have just inaugurated. It's like a dream project for you.
Yes, true. True.
It's a dream project. I can fully imagine, how wonderful you must be feeling. I've been hearing about this for so long. And this happening, I mean, I'm so excited about it that I can't really express. So Dr. Sandesh, before anything, let me just start off with asking you what services and treatments would be available. Can you hear
Sorry.
me?
No, now can you ask the
So I was
question?
asking, yeah, I was asking what kind of services, what services are exactly uh, are going to be offered in your facility, and what treatments are would be given to the patients. If it's my network or I think I can't hear you.
Can you hear us?
Your voice, I can't. I mean, it's getting stuck. I'm not sure if it's my network. Can you all hear me?
Yeah, I can hear you.
Can some- you can hear me? Fine. Now I can hear you. Now it's better.
Yeah. So the
Yeah.
main focus is on a multidisciplinary team. So as you know, BURJEEL Medical City is a biggest hospital in Abu Dhabi, where we have
Mm-hmm.
all the departments. We
Mm-hmm.
have a lot of bowel surgeons, the urology department, the neurology, the physiotherapy, and the intensive care unit, and a lot of operation theaters. Here we are very well equipped with the laparoscopies, hysteroscopies, and even now the robotic surgery.
Oh,
So
amazing.
it was an ideal position for us to start with a multidisciplinary team, and so
Mm-hmm.
that's why. And I would like to introduce our team
Oh,
of
we would love to meet
multidisciplinary team.
them.
Yeah, I'll just put the camera toward them, and you will see one of the leading of gynec surgeons and the endometriosis surgeons in the world. Will have Professor Horace Roman. Say hi.
Oh, it's so lovely having you
Nice to see you.
over. I mean, I've been following you for such a long time.
Thank you very much. Okay.
Congratulations.
So
Congratulations on
we are,
this
we are,
beautiful facility.
we are happy to,
Yeah.
to
Now,
build to build
yeah, we
together.
will introduce to you second expert surgeon, Benjamin Merlo.
Hello, doctor.
Hi. How are you?
Hi. Congratulations to you too.
Thank you so much. We're so happy to build this team
Yeah.
and to work here.
Uh,
We have a
oh,
very renowned intervention radiologist who is going to interpret the MRIs for us, Dr. Cartred.
wow. One of the most amazing things to happen in radiology.
And now I would
Congratulations.
like to introduce Dr. Monica Chauhan, the lead
Uh-huh.
gynecologist for us here for endometriosis.
Amazing. Hi, congratulations. Congratulations.
Hope to see you
I'm
someday
so
here.
happy that we actually finally I got to meet the entire team. I have been hearing about all of you so much from
Yes,
Dr. Sandesh, and
yes.
it's an honor to meet all of you. Yeah.
Thank you. I've heard lots about you and keep up your good work.
Thank you so much. Thank you so very much.
We have the other arms in advanced gynecology. We have with me Jaf Abu, He is the lead oncology surgeon.
Oh, hello.
Lovely to
Hello.
see you. Lovely to meet you.
It's my pleasure. Completely my pleasure.
Thank you.
Yeah. And we have Dr. Khalid.
Hi, Dr. Khalid. So nice to meet you.
So this is a tie-up between BURJEEL Medical City and
Mm-hmm.
IFEM, that is the Institute Franco European for Multidisciplinary. And I'll just
Mm-hmm.
show you our logo, that is IFEM, and we aim to target this for not only UAE but the whole of Middle East. And like you know, Dubai is a destination center for so many, so it's open for all over the world. So I'll just introduce to you our logo.
Amazing. This is beautiful. This is just beautiful. Lovely. Lovely.
So we are going to follow our database on the same path as Bordeaux has, that is the software that is No Endo, and that will help us to have a research for the people who are here in Middle East and to identify the endometriosis pattern in this population, or also here at any given time we know we find 35 nationalities at least in any mall if you go in the big mall. So we could be like a
Absolutely.
very diverse culture as well, to know exactly how endometriosis represents in such a situation. So we have this database called as No Endo, which would be
Mm-hmm.
our backbone of service in Burjeel Medical City.
Beautiful, beautiful. This is like so amazing because I know of a lot of people from India traveling to Dubai and UAE to get their treatment done. So I think this is something, this world-class facility coming up there in Middle East is something which would help us also. So Dr. Sandesh, I wanted to ask you, obviously my next question was about the dedicated team, but I've seen the entire team, so I have no doubt about how the quality of treatment would be. So now I'll come to the next question. So how will the facility ensure timely and accurate diagnosis of endometriosis?
First thing is we are aware that there is a diagnostic delay of so many years, 7 to 10 years,
Mm,
and just that delay itself tells us that that poor lady is going to suffer more for that many years. And as
correct.
you know, this is a progressive and a very aggressive disease,
Right.
so it's not going and not limited to the pelvis but the whole body. So delay on part of physicians is actually going to make us detect it very late, and by that time the organs are going to be damaged. So here
Right.
we are going to create more awareness. That is first thing. And fortunately, I would like to share here is that in Middle East or the Arabic culture, the
Mm,
work for a parallel word for endometriosis does exist. I
um,
found this very difficult in India. In my own language, we have no parallel word for endometriosis, but here
right.
we have it. So it will be easy for us to create this awareness. And for today, like as you know, the second part of this is the awareness through art is also going exhibited here. I will show you few
Yeah.
pictures. So it is
Yeah.
going to be easy for us. That's what I feel. Secondly, here we are going to go right from the teenage, identify girls who are missing their school, or we have other facilities, the history taking, and even we have first here we have to do an ultrasonography in a clinic. We cannot directly go to an MRI here. So if at all there is requirement, and MRI would also be done. So based on the same model as Bordeaux, we would be relying pre-surgically on MRI. So these are the
Mhm.
tests. And as you know, few tests are coming which are non-invasive. They are already in discussion that can it be implemented, because mostly the culture here is for an insurance-based population. So if the companies give good provide good adequate equipments, and we can diagnose it non-invasively, that would be very fantastic. But as of now, it is in early phases. So that would be for a trial basis, not for a general mass screening that would be used.
Hmm. Oh, that will be like a blessing in case that is in case something non-invasive comes up for the diagnosis of endometriosis. That will be like I think a complete game turnaround, from
Absolutely.
what we do right now.
Yes.
So tell me something. So what kind of imaging technology would you be using at the facility to diagnose?
See,
And obviously the
uh,
treatment planning.
for basically in the clinics, we are equipped with the best of the ultrasonography machines. So from imaging point of view, ultrasound would be a very early and the partner with us in the diagnosis. In ultrasound, we are trained to pick up the uterosacral nodules, the adenomyosis in the uterus, or the ovarian cyst, of course, and the bowel involvement, ureteric involvement. And so we follow the protocols as given by the international standards, go compartment wise. And here, for diagnostic as well as therapeutic, we follow the NZN classification as well, which is very easy, and it is the standardized and very well validated. So that's what we are following right now. So ultrasound on the first step is our first thing, and secondly, we also would go on MRI pelvis with and without contrast. So we have designed the Dr. Carteret has given us a protocol to how in all the facilities. So for BURJEEL, we have around 16 hospitals and all are linked with each other. We have made a pathway of patient referral, which hospitals can perform what type of surgeries. Okay, and so all the advanced surgeries or the colorectal, the urinary tract, diaphragm, all this will be referred to the terminal referral place, that is BURJEEL Medical City in the Advanced Gynae AGI, Advanced Gynae Institute, and be having multidisciplinary meetings every weekly before every case is operated, and there will be a lot of brainstorming and understanding each and every case, and only then she will be posted for the surgery.
Okay, okay, okay. Get that.
Then
So now,
colonoscopy, other investigations are also available. Sorry to miss that part. As if you need colonoscopy, or that is not so frequently required, but if you need any urological tests to know the functioning of the kidneys, so all bladder function tests will be done, and we have the other MRIs for diaphragm. All this can be performed because it's a very equipped hospital. So we are sure that we will offer them the best treatment.
absolutely, that's like wonderful. So now, the next question, I have no doubt about the kind of surgeries that would be performed there and the kind of diagnosis which will happen with the kind of specialists that you have. But now, my question to you is, besides endometriosis surgeries, do you have any other modality, comprehensive treatment options like probably IVF, infertility experts, plus your, mental health experts, plus pain management, because a lot of people, even after the surgery, do have pain, right? So, what kind of comprehensive treatment options do you have there?
See, it is a very important part of endometriosis. 30% people are affected with infertility, experience infertility. So, like we were discussing, if we have a busy center of IVF with us here, who performs 200. So we expect them to at least have 60 patients every month who are
Yeah,
actually endometriosis cases. And
correct.
here in the Middle East, the government, because they have declining population, it is promoted. So
Hmm.
it is taken very seriously, the fertility aspect. So we have good support from the government, also the insurances, and everybody, even if it's a fertility issue, is for the locals, it is gets insured. So very easily we can perform the investigations and the surgeries if required. And we have very good publications from Horace about how surgeries for grade 3, grade 4 severe endometriosis can improve the fertility.
Mhm.
So that is one aspect. And the physiotherapy unit is very equipped. There are dedicated people to train or they do pelvic floor muscle exercises. And so physiotherapy part or pain management, we have pain clinics here. And so everybody is linked, and a complete multidisciplinary activity is going to happen, and every aspect of endometriosis is going to be taken care of.
That sounds relieving because pain is one of the things which a lot of us face even after the surgery. So, how do you, how as a facility would you?
I would also ask Horace also to join us and be a part of this because he is these are the international partners for us. They have questions for us for endometriosis as well. It's okay.
I
Yes,
welcome
just
Dr.
let me take my glasses to see you better. Okay.
No, welcome, welcome. I'm so honored that you are also there here to answer our questions. So I was asking Dr. Sandesh, how will the facilities stay updated with the latest advancements and research on endometriosis and diagnosis as well as treatment?
Sorry, just a minute. I have to go somewhere with less noise.
Sure.
Yes, please repeat again.
So I was asking, how will the facility stay updated with the latest technology or latest advancements in research and in the diagnosis and treatment of endometriosis?
Yes. So you speak about the facility here in BURJEEL. Yeah. So when we come from the Franco European Institute in Bordeaux here, we come with a project. The project was to build a team based in BURJEEL of the very high level of care.
Okay.
But also clinical research and training. So that's what we are doing in Bordeaux. So in Bordeaux, Bordeaux is among the two institutes, European institutes, with the highest volume in surgery of endometriosis, severe endometriosis, and clinical
Yes,
research.
I've heard of that. Yeah.
So the director of the facility accepted to order a robot, so we'll do the robotic surgery, which is very interesting for several localizations of endometriosis, such as the low rectum, the sacral plexus, the sciatic nerve, or the diaphragm. So this has been done. Also me, I work only with 3D laparoscope. So I want to see in 3D what I'm doing, and they ordered the 3D laparoscope. As regard to research, performing a research requires first to record all the procedures, the symptoms, the findings, the procedures you're doing. So this requires a database, a software to record everything progressively every day in the database. What are we doing in Bordeaux, where I spend 1 hour a day to record my data. And this allows me to publish a lot of clinical studies on very large population of patients undergoing surgery. So this software will be performed within 2 months.
Oh,
so it will be available
amazing.
and will be the same we use in Bordeaux, meaning that we can merge the two databases to do common studies, which is
That's what
logical because it's the same institute. And as regards the diagnosis, we came with our colleague radiologist, which will improve the level of the radiologist. So we have a meeting with the radiologist Wednesday evening, and then we'll invite radiologists from here to come in Bordeaux in immersion in our institute for 1 or 2 weeks. And then the diagnosis, we will also try to evaluate and to promote the salivary test, which is an endo test, which is salivary diagnostic of the endometriosis, which may prompt the diagnosis each time when the imaging techniques are negative and you do not know very well if the patient has or has not endometriosis. So now we are involved in research, in the assessment of this test, and not later than next month, we'll be part of a team which published in a multidisciplinary study, which published the results in New England Journal of Medicine, which is the highest level journal in the world, about the diagnosis of endometriosis. We'll develop everything in BURJEEL.
Okay, awesome. I mean, this sounds really promising, and it gives hope to a lot of people like me, with endometriosis, who keep going on and on with one surgery after another, and a lot of diagnosis, I think, gets delayed because obviously because of the surgical diagnosis. If something non-surgical comes up, I think it will be like
Yeah,
amazing.
the salivary test, the first study is done in 1,200 patients,
Oh,
provided a sensitivity and a specificity which
mhm.
is close to 100. It means that there are very,
Wow,
very, very rare false positive or false negative results.
correct.
It
So
is
the
quite
accuracy is like
beautiful.
amazing.
Yes.
Yeah. That's amazing. I look forward to something like this coming up. I'm like looking forward for it to come to India also, because then things will really speed up. The diagnosis of so many people would get speeded up really fast. So now I wanted to check, how would the facility provide educational research resources to the patients, the support groups for the patients? How do you plan to promote them?
Huh?
You will be surprised that day after tomorrow we have a patients evening, and here we have invited all the patients who have faced whatever they have to speak about this disease, and all the doctors will be sitting in the audience, and the patients would be questioning. It would be reverse. Okay, so if they have any yes, so we are ready. They should feel that we are here to listen to them. We are not ignoring them, or we really want to understand from them what exactly they are going through. So we have that is the first activity of patient evening.
Perfect.
And
Perfect. That would be super interesting to see what questions the doctors would get, because it's always the other way around mostly. So, my last question for people like me who may not be able to travel to UAE because of some commitments or the other, do you have any teleconsult facility which is available?
Yes, I will just take you around very quickly to our meeting and multidisciplinary room where we have medicine available. And
Mm-hmm.
here, if Horace or Benjamin or the team is not here, we would
Mm-hmm.
actually be having a telemedicine for them. So I'll just take you to
Okay.
from the facility to that. This is our clinic. Okay.
Mm-hmm.
So
Okay.
here we have all the consultation rooms, and this is our telecommunication medicine room here.
Mm-hmm.
Okay.
It looks really beautiful.
Yes, yes, yes. Thank you so much. And so, if the patient chooses to have a tele consultation, so that is possible from here. And we have the expert diagnostic people to give the diagnosis for their reporting on the MRI, or if there is something about surgery they want to know about the possible complication rates or the recurrences. We are open to help them in any ways they want, even if they are performing their procedures or they have queries that they want to know more about. So it would be open, like how our patients also can take second opinion anywhere. We are
Correct.
there to support this activity for every patient. Yeah.
Amazing. That's like good. I think there will be a lot of patients who would want to come there, take this telemedicine thing very seriously, because obviously there are confusing diagnosis that happens, confusing treatment plans that happen. So taking a second opinion is always a better way of going ahead with anything, any surgery for that matter. So anything that you want to add on
Uh,
the
we
fest?
have conducted a awareness through art activity,
I would
and now I will.
I would want you to show it to our audience,
Yes.
the art that is something which I've been so wanting to see myself.
He meet this artist, Mr.
The
Sunil
artist
Saraf.
first. I've
Namaste.
heard so much about you.
Thank you. So now we'll just show you some of his
Yeah.
paintings through which we have tried to create an awareness. This is the first. I don't know if you can see it. Can you see this? Okay, I'll just go with the smaller images so it can be seen better. So here the artist has tried to show how this disease actually affects women and how it affects their personal or their social or their professional atmosphere. And so he's tried
Hmm.
to show that this disease can really wither them. And this is an art which he has shown. Can you see this?
Yes, I can.
And here he has tried to show how the butterfly is losing its like wings, and
Wings. Yeah, yeah, yeah,
yeah,
yeah.
and very beautifully he has tried to connect the butterfly with the patient. If you can see this tentacle,
Yeah, yeah,
can you see it?
yeah.
It's connected.
Yes,
Yeah.
yes, yes. That's right.
So he's just tried to show that very
So
beautifully. Okay.
thoughtfully done. Yeah, yeah, yeah.
Yes. Then I have one more art piece which we want to show is that endometriosis. Can you see this image?
Yes, I can.
So, like how
Can
endometriosis
you
is
take it
an
a
enigma.
little lower, doctor? Yes, this is
So, how
perfect.
it's like a puzzle, it's like a riddle, and why we
Hmm.
delay in diagnosis, and it's like we should not waste time in diagnosis. So,
Hmm.
it's an enigma at present, but with a good protocol based approach, I think we all can have it diagnosed earlier. Okay.
Hmm.
There's one more I would like to show is this. Can you see this image?
Yes, yes.
We all know that the endometriosis patient
You have to take it a
lands up
little
with,
lower.
yeah, it shows how
Yes,
a patient lands up with 5 to 7 surgeries in her lifetime, and the
correct.
first surgery should be her best surgery. So it's
Hmm.
just to depict that. But there is no negativity in any picture. There is always a hope, like that's
Correct.
seen in this flower,
Hmm.
that if you choose the best surgeons, maybe your first surgery would be the best, and the recurrence rate
Absolutely.
would be the least. Very soon,
Correct.
Horace is coming up with his already publication
Hmm.
where he has shown how low is the recurrence rate if the surgery is performed well, and he has really
Hmm.
studied it through 3 years, 5 years, 7 years, and 10 years. So
Amazing.
definitely there is a good hope for the patients to that the recurrence can be very very less if you do the surgeries correctly.
Hmm.
And there's
Hmm.
one more art here. Can you see how it depicts how a
Yes,
patient, her life is as if she's caged. Okay,
correct.
here you can see
Correct.
actually the bird is free while the patient is caged, and this is what exactly happens in their
Just
lives.
beautiful. Just beautifully done. Very, very
Yes.
beautiful.
So this is just to create, because we wanted to create that impact through art, and
Hmm.
everybody, believe me, everybody who came here related very well. The patients related very well to these images, and so that is going to be a very very strong. If they could identify any of their friends or somebody suffering through this, I think that's going to give them a big encouragement that here we have a center where we should refer. And I'll just show you one more, two more pictures.
Yeah.
Here
Yeah.
is the sacral root or the nerve involved where the patient has severe and stinging pain.
Correct. Correct. Oh, wow.
And it
This is
shows
like.
the red color shows the inflammatory process of the endometriosis,
Hmm.
how this
Right.
disease is like an inflammation. Okay.
Hmm.
And about the pain factor
Yes.
also, we have a small picture which shows that it runs in families, twins affected. So if
Mm-hmm.
you have one sister affected by this, the other needs immediate urgent attention or to be diagnosed early.
Correct. Correct. That's right.
And here we have one very important picture. As you know, the yellow color is the canvas for endometriosis. This was a plain yellow canvas. This was awareness we had created in Sholapur. where everybody who attended has written and given us a strong message, and most of them have told that they are there with the patients. So we don't want the patients to feel neglected. You know, at families also the patient experiences that nobody is listening to them or they are alone. So we want
Correct.
to give a strong message to them that everybody is there with you. Slowly, because there was no awareness at work,
Mm.
also people were not understanding, the colleagues or family members were not understanding these young girls. So as we
Mm.
create awareness, everybody would be there to support these endometriosis patients with them. Yes.
This is just amazing. I mean, what beautiful paintings. This is out of the world.
Yeah.
Really,
And
really. I mean,
one,
congratulations to you
this is
and to the
my,
artist.
yeah. And one painting related to adenomyosis, where actually you have severe pain and excessive bleeding.
Mm.
So that has been depicted here. Can you see this painting?
Yes, yes, yes. Very nice. Very, very nice. This is this is just beautifully done. Amazing. Amazing. Really, really. I mean, the impact would be like much more than what it could have been without the paintings. I mean, the paintings would surely add on to the impact about endometriosis.
Yeah. It will
You
stay. Some patients who come can identify them their own story with these paintings somewhere, or it would definitely create awareness, I'm sure.
Absolutely, absolutely. I have no doubt about it. So, the man behind the paintings. So, I think my questions now would go to Sachin,
Yeah, just a minute.
right?
He's
Yeah.
joining with us. Sachin, Sachin, Sachin. We really have to appreciate him because he's not a medical person,
Yeah,
and
but he still could
understand.
understand so much,
Yes.
and he did it.
Marathi.
हॅलो नमस्कार
Hi.
नमस्कार
Namaste.
मराठीत बोलू का
मराठी मुझे समझ में आती है बट
मैं
आई कांट
हिंदी
स्पीक इन मराठी
चलो
हिंदी
हिंदी में बात
हिंदी
करता हूँ
हाँ
अच्छा
हिंदी वुड बी
चलो
बेटर
आप पूछिए आपको कैसे लगता
सो पहली बात तो कंग्रेचुलेशंस आपने जो ये आर्ट वर्क किया है इट इज जस्ट फैंटास्टिक
है
आउट ऑफ द वर्ल्ड
यस यस यस
सो the first question is what has inspired you to create paintings specifically about endometriosis.
फर्स्ट ऑफ ऑल तो मैं धन्यवाद देना चाहूंगा संदेश कादे सर को क्योंकि इन्होंने मुझे बताया इंडोमेट्रियोसिस क्या है। ऐसे ही 5 बजे सुबह फोन आया और बोले कि मैं तो सोया था पूरा, तो सर ने बोला यार एक काम था, आप थोड़ा टाइम है क्या 5 बजे? मैं तो यार 5 बजे क्या काम होगा, मैं तो डर गया। तो फिर वो 5 बजे डॉक्टर का फोन आता है तो आदमी डर जाता है कि वो क्या हो गया। तो उन्होंने बताया कि इंडोमेट्रियोसिस का एक डिसीज है बहुत बड़ा और बहुत बड़ी बीमारी है, उसके ऊपर अभी मैं काम करता हूँ तो मुझे लगता है कि आप उसके ऊपर पेंटिंग कर सकते हो क्या? तो मैंने बोला मैं उसमें कुछ भी दिमाग में नहीं था, मैंने बोला यस कर सकता हूँ मैं, कोई टेंशन नहीं, हम लोग कर सकते हैं। तो जैसे जैसे मैंने 1-2 महीने 3 महीने हम लोगों ने स्टडी किया, मैंने पूरे बीमारी का स्टडी मैंने किया। अभी मुझे ऐसा लगता है कि बस मुझे डिस्क्रिप्शन ही देना बाकी है पेशेंट के लिए, बस बाकी मैं सब कुछ कर सकता हूँ। अभी मुझे सब समझ में आता है कि उसके पहले क्या होता है, उसके पेन कैसे होते हैं, क्या होता है, प्रॉब्लम कैसे होते हैं, और ये सब कुछ मैं जान के मैंने 2 महीने 3 महीने स्टडी किया और पूरे पेंटिंग वो समझ में आ गया कि ये बहुत बड़ी डिजीज है और ये बहुत बड़ी बीमारी है महिलाओं के लिए। और मुझे लगता है कि एक आदमी महिलाओं का प्रॉब्लम समझ सकता है और मुझे समझा सकता है, और मैं पेंटिंग के द्वारा एक महिला का प्रॉब्लम मैं लोगों को समझा सकूंगा मेरे पेंटिंग के द्वारा। तो मैं खुश नसीब था, मैं मतलब मुझे करना चाहिए और मैंने किया वो।
दैट इज अमेजिंग, बहुत ही अच्छा काम किया बिकॉज आई एम श्योर यहाँ पे इंडिया में पहली बात तो इसके बारे में कोई बात नहीं करता है, बट आपने अपने पेंटिंग्स के थ्रू इतने अच्छे से उसको डिपिक्ट किया है। सो आप ये बताइए कि हाउ डू यू थिंक दैट आर्ट से आप किसी चीज के बारे में अवेयरनेस क्रिएट कर सकते हैं? आपको ऐसा कैसे लगा?
हाँ, क्योंकि देखो बोल नहीं सकते, क्योंकि ये चीजें जो है वो बहुत शाय जैसी होती है, लड़की घबराती है, बोल नहीं पाती है। तो मैं ख्याल से मैंने एक प्लान किया कि हम लोग पेंटिंग के द्वारा
जाए और एक एग्जीबिशन किया जाए। जो मैं महाराष्ट्र में रहता हूँ, सोलापुर में मैंने एग्जीबिशन किया और उस पेंटिंग के बारे में लोगों को बताना चालू किया मैंने। कम से कम 1 महीना अवेयरनेस किया मैंने कि ये काम कर रहा हूँ, ये काम कर रहा हूँ। हैमर करते रहा मैं, लेकिन लोगों को समझ में नहीं आ रहा। मैंने पहले मेरे घर वालों को समझाया, फिर मेरे दोस्तों को समझाया, फिर दोस्त ने दोस्तों को समझाया, ऐसे चैन लेके मैंने करके कम से कम मैंने सोलापुर के 5,000 लोगों को ये एग्जीबिशन दिखाया और उनसे साइन लिया। उनका साइन लेके मैंने एक पेंटिंग बनाया कि वो इंडोमेट्री के खिलाफ उनको लड़ना है और उनको काम करना है। तो वो जो पेंटिंग है, तो ये पेंटिंग है जो साइन किया हुआ।
हाँ, देखा मैंने, and it is like
हाँ,
so interesting to see
तो
so many people.
तो हम लोग साथ में हैं और मुझे ऐसा लगता है कि हम लोग कोई साथ में रहेगा तो कोई प्रॉब्लम नहीं है। ऐसे कोई इंस्पायर करेगा। अभी मुझे इतना बड़ा अपॉर्चुनिटी मिला कि यहाँ पे ये पेंटिंग लग रहा है। दिस इज अ बिग थिंग। मुझे भी अच्छा लग रहा है कि मैंने ये काम किया है और मैं ऐसे ही काम करता रहूंगा। और अभी मेरा नया प्लान है कि ये पेंटिंग के प्रिंट निकाल के मैं पूरे गांव में, जहाँ पे ये शहरों में पता नहीं लेकिन गांव के लड़कों लड़कियों के बारे में इनको कुछ भी नहीं पता है, मैं वहां पे पूरा एग्जीबिशन का शो फ्री ऑफ कॉस्ट लगा के मैं इसके बारे में मतलब काम करना चाह रहा हूँ। और ये बहुत ही
That
मतलब
is
डिफिकल्ट है, लेकिन मैं ये करने वाला हूँ
बहुत
और मैंने बहुत
नोबल, बहुत ही नोबल काम है। बिकॉज द थिंग इज, जितना जब सिटीज में रहने वालों को ही इसके बारे में नहीं पता है, तो इमेजिन गांव में जो रहते हैं उनका क्या होता
नहीं,
होगा।
नहीं, कोई
नो,
नहीं, बहुत प्रॉब्लम है। और जब मैं एग्जीबिशन कर रहा था मुझे 4 पेशेंट मिले। 4 पेशेंट मुझे के मिले जो उन्होंने वो किया कि ये सब कुछ मुझे होता है, ये जो बता रहे हो ये सब कुछ
सही
मुझे हो।
बात है,
तो बस हो गया, मेरे को 4 पेशेंट मुझे मिले और मैं जीत गया, बस और क्या
सही
चाहिए।
बात है, सही बात है। बट अभी आप एक बात बताइए, अभी जो पेशेंट्स हैं या people like me who work towards creating awareness, so if we want to connect with you,
अच्छा,
so how do we do it? In the sense, आपसे इसके बारे में अगर हमको हेल्प लेना है किसी एग्जीबिशन, जैसे आप बता रहे हैं एग्जीबिशन, जैसे हमको अवेयरनेस के लिए करना है, तो हाउ डू वी गेट इन टच विथ
तो
यू
हम लोग
एंड
अभी
व्हाट कैन यू डू फॉर अस?
हम लोग तो टच में अभी रह गई है, संदेश सर भी है। और मेरा मानना है कि ऐसे एग्जीबिशन होने चाहिए। जैसे आप रह रहे हो एक जगह, तो वहां पे एक कंडक्ट करना चाहिए, किसी को तो लीड लेना चाहिए। हम लोग तो पेंटिंग करवा के हम लोग एक 2-3 महीने का टाइम, 3-4 महीने का टाइम लेके पेंटिंग नया बना सकते हैं। अभी ये तो इधर रह गए, समझो हम लोग को यही पेंटिंग का प्रिंट करके हम लोग एग्जीबिशन करना चाहते हैं तो वो भी कर सकते हैं। ये प्लान होना चाहिए, बहुत लोग जुड़ने चाहिए इसमें। हम लोग अकेले कुछ नहीं कर सकते, साथ आना चाहिए लोगों का। सो मुझे लगता है ये इजी रहेगा, हम लोग साथ में रहेंगे तो।
एब्सोल्युटली, एब्सोल्युटली। हम तो probably we'll anyways be in touch, and I think जो आप बता रहे हैं that exhibitions, print के exhibitions कर सकते हैं, which is a very very good idea.
Yes.
And अगर कुछ और भी ऐसे कोई problems need awareness, I would surely get in touch with you. You know, but
yes,
you have done a fabulous job. You have done a fabulous job. This is like,
Thank
I mean, I
thank
can
you.
relate to it completely. You know,
Oh,
being an
thank you.
endometriosis patient, I can completely relate to it. Seeing each painting, it is beautiful. Thank you very much. Thank you.
टच में रहो आप, एनी टाइम कोई भी जरूरत हो आप मुझे बोल देना। आई एम
बिल्कुल।
मैं कभी भी टाइम निकाल के आपके साथ
Thank you. Thank you so very much. Thank you. All right. Bye bye. Take care. Bye. So I think our audience had a beautiful time visiting this facility, and I was like super amused to see a wonderful endometriosis facility coming up in the Middle East. Stay tuned with us. We will come online with another story, another person, and we would keep continuing to do what we keep doing, increasing awareness about endometriosis with each post, with each live, one step at a time. And together, I know we would be able to make a difference. Thank you so much. Thank you everyone who joined us online. And thank you so much for everyone who is going to see this recorded version. Thank you and have a good evening ahead. Bye-bye.